Hello everyone, welcome to our December 2018 Health Talk. Tonight we're going to be going over integrative dry needling. I hope to answer some questions that you may have regarding it. I will be putting this PowerPoint on our Facebook page so you can go back and watch it again and pause and read if you need to, if I go a little fast for you. So I'm going to go ahead and get started here tonight. And my name is Dr. Brandon Morris. So what does IDN stand for? IDN stands for Integrative Dry Needling. Integrative means that it's integrating all the different theories and research of the different generations of dry needling. So this is the newest form of dry needling. Dry, it means there's no medication or additive to the needle. And needling, well, it's a needle. That one's pretty simple. So dry needling definition by the founder, who is known as Dr. Ma. Dry needling technique is a modern Western medical modality that is not related at all to the traditional Chinese acupuncture in any way. Dry needling has its own theoretical concepts, terminology, needling technique, and clinical application. Dry needling was first developed in 1940s by Janet Travail, who was a medical doctor, former medical advisor to the White House. She was also John F. Kennedy's physician. Thus, dry needling, aka biomedical acupuncture, is based on modern understanding of human anatomy and pathophysiology, and on modern scientific research, drawing heavily on leading-edge neurological research using modern imaging techniques such as functional MRIs of the brain. Different terminology for dry needling technique have been created. For example, trigger point needling, dry needling technique, intramuscular stimulation, and biomedical or medical acupuncture are all in use today. Dry needling is an invasive procedure in which a solid monofilament needle is inserted into the skin and muscle directly at a myofascial trigger point. This is one generation of needling. In integrative dry needling, I actually use multiple types of trigger points, which we'll go over in a minute, but this is just dry needling in general. So a myofascial trigger point consists of multiple contraction knots which are related to the production and maintenance of the pain cycle, which is what we are trying to alter here. It is not the same as acupuncture, which is actually based on a metaphysical theory of normalizing energy flow in the body. Dry needling is Western medical technique that is used and is based on scientific research and studies and knowledge. Okay, over here we have a basically anatomy of a nerve. We call a transverse or cross section. Nerves actually do have little blood vessels in them, most do, and this is just showing you the different levels and layers and views of within the nerve. Don't really need to go into that too much. Just wanted you to notice kind of how complex they are. They're not just little simple things. They're rather fascinating. Here's a picture of a muscle, okay, cross-sectioned here. Again, I'm not going to get too much into the anatomy of it. I'll let you go back, pause, and look if you'd like. But just know again that there's a lot of different complexities that involve what we just call a muscle. Okay, it's composed of many different smaller things and are very, very intricate. Just know that the myofascia actually is the coating around them, not the epimysium, but ties into that. Okay, so dry needling is a treatment that involves a very thin needle before being pushed through the skin in order to stimulate a trigger point. So why would you use it? It's used to release tight muscle bands that are associated with a trigger point or hard knots within a muscle and cause pain over a large area. Sometimes these knots can make it difficult to perform everyday tasks. And dry needling, let's look at the differences here between wet needling and dry needling first. Dry needling involves The insertion of a needle into muscles, ligaments, tendons, subcutaneous fascia, scar tissue. And what an integrative needling, actually homeostatic trigger points as well. Wet needling, however, they call it wet because there's usually some type of medication or additive to it, such as corticosteroids, sclerosants, other agents. So dry needling versus acupuncture. Dry needling focuses on stimulating a specific trigger point that's leading to pain and disability. Acupuncture is more or less determined to unblock energy meridians and help create balance within the bodily system. Dry needling, needles are inserted into the body and gently manipulated sometimes, and it's a very short period. Sometimes we repeat that several times in the same area to create what's called a therapeutic lesion, which I'll go over in a moment. Dry needling also treats specific neuromuscular and neurological trigger points. These needles are intended to release tension, inflammation, and also chemicals or pressure on a specific trigger point. And they're also can interrupt the pain cycle and neurologically alter the circuit between the pain area and the brain. Acupuncture is actually leaving the needles in the body for some time, most of the time, to work on the meridians and the energy portion of the body. And it addresses the flow of energy around the body and the vital organs. Needles are inserted into established meridian points. And acupuncture is based on traditional Chinese medicine, which dry needling is not. So I really just want you guys to just get the concept that dry needling, especially integrative dry needling, is not the same thing as acupuncture, and why. They're both very, very good, very useful. I believe in both. I just want you to leave tonight or today, if you're viewing it later, to see the concepts are quite different. So how big are the needles? That's what most people would like to know. They're very small. So here I got a matchstick, a medical syringe, a sewing needle, and then the dry needle, as well as the sizes. I also know that the dry needle down there, actually it says 0.25 millimeters. They actually can be smaller than that, or they can be slightly bigger than that. But usually 0.5 is about the largest. But I usually use 0.15, 0.20, 0.25, 0.3. Okay. So again, a little bit more with dry needling versus acupuncture. Why modern needling is not traditional Chinese acupuncture. Modern dry needling is not TCA because dry needling practices is based on the laws of modern medicine, while traditional Chinese acupuncture is based on the laws of traditional Chinese medicine. Modern dry needling has developed on the foundation of modern Western medicine, which consists of biology, chemistry, and physics. Each scientific field may offer dry needling the information from many subfields, such as molecular biology, physiology, pathology, anatomy, kinesiology, and even more. Medicine is an applied biology and obeys the laws of chemistry and physics. Science advances when new information is obtained and different from the old. The law of science may change. So the laws of modern medicine may change. Dry needling is advancing with science and the new laws of medicine. Thus, dry needling is dynamically advancing and will not stay stagnant in its evolution. Traditional Chinese acupuncture was developed at least 2,500 years ago in ancient agricultural Chinese society. Ancient Chinese believed that there were universal laws that govern the universe, nature, social structure, like family and politics, the human body and human medicine and disease. These laws are in fact a product of Chinese agricultural civilization and philosophy. The first law of traditional Chinese medicine is the yin-yang. The second law is the interrelation of the 5 elements. Then there are numerous minor laws that govern the traditional Chinese medicine and traditional Chinese acupuncture. The third law is the qi, or vitality and energy, that exists in every entity. If the new information contradicts with those universal laws, the information must modify to fit its universal laws. The traditional Chinese acupuncture community believes that Chinese medicine is different from modern medicine and it does not obey modern scientific laws, and the scientific method cannot be applied to it. However, the laws of Chinese medicine are just human-formed historical concepts, not natural laws. Thus, acupuncture theories like the central concept of meridians have been regarded as fact, not theory. and have been humanely kept in its antique form for thousands of years. Dry needling techniques are based on the laws of modern medicine. These laws are rules nature must live by. The laws that format traditional Chinese medicine and acupuncture are human-created concepts representing ancient human thought and bias. This is the fundamental difference between modern dry needling and traditional Chinese acupuncture, though both are clinically effective. Current research and clinical data has modified the hypothesis and clinical techniques of modern dry needling. Thus, the result, neurologic dry needling. So research demonstrates the clinical outcomes of needling. Official acupoints and non-acupoints are equally effective. This falsifies the uniqueness of meridians and acupoints. Trigger point hypothesis trigger points can cause myofascial pain. Based on this hypothesis, it is important to identify and deactivate the trigger points. This approach can be clinically effective. However, a non-trigger point approach, such as a superficial needling or needling of distant points, can also reduce or heal myofascial pain, even though the trigger point was untouched during treatment. So various research sources cite an overlap of the named trigger points and acupoints ranging from 80 to 100%, claiming that they are the same points. Thus, the same scientific discovery can be applied to the trigger point hypothesis. Third, the clinical evidence demonstrates that healing can be achieved by both local symptomatic and distant points. Based on research and clinical data since the 1960s, the meridian theory, and now we are in trigger point hypothesis. The result has become integrative dry needling and neurological dry needling, and it was developed and synthesized by all the scientific and empirical data. Okay, so that was a mouthful. So now that we've got more of the differences between traditional Chinese acupuncture and the neurologic or integrative dry needling, let's move forward to what dry needling approaches. So integrative dry needling specifically is different from dry needling because we approach it from a level of the 3 S's: symptomatic areas, segmental, okay, which segment of the spine or nerve is it coming from, and then systemic, so we follow that nerve out to the symptomatic source. Our approach considers the systemic neurological relationships of pain and tissue dysfunction, as well as sensory nerve modulation and physiology. There are currently 3 generations of dry needling. The systemic concept of dry needling allows the practitioner to view and treat the body as an interrelated organism, essentially the Gestalt theory, as it's known as, yet allowing the clinical freedom to adapt the treatment for each patient. As a result, integrative dry needling provides the framework upon which to address all types of physical dysfunction. Integrative dry needling can be considered the 3rd generation of modern dry needling. So intraneural circulation, I wanted to bring that up. So within the nerve, as you saw earlier in the anatomy, nerves do have circulatory vessels within them, okay, and it's called intraneural because it's inside of the nerve. So if we have problems with the nerve getting its own supply of blood, nutrition, etc., getting rid of toxins, then we're going to have a problem with that nerve and that whole kind of chain there wherever it's going and coming from. So one part of dry needling too is to improve intraneural circulation. So the trigger points here that I want to go over is muscular trigger point, which is what this means over here, MTRP, HM, which is homeostatic trigger point, and we also have a systemic, segmental, or symptomatic trigger point. And this is peripheral neurological trigger point. Okay, so this is a big model of sort of the pain cycle to a degree, okay, without going into the actual brain anatomy and physiology. So you see up here on the top right, we've got a tack or pin here put into the body, goes up the sensory neuron to the association neuron to the integrating center here within the dorsal column. This is your spinal cord here, kind of transected that you're looking at on the left. Then it goes to the motor neuron, you say ow, and then you kind of jump. Okay, so what we're trying to do is effectively modify the physiology and the neurology to this reaction if you have chronic pain. Okay, so how does it work? Integrative dry needling is based on neuroanatomy and modern scientific study of the musculoskeletal and neuromuscular systems. A very, very fine filament needle is inserted through the skin and into deeper tissues considered trigger points to address sensitive and sensitized areas to create a therapeutic lesion. Dry needling works by causing a therapeutic microlesion within the pathological tissue, thus breaking up shortened tissues, inhibiting a reflex arc from the nervous system to the tissue, normalizing the inflammatory response, and centrally mediating the pain, not just locally. This mechanical, neuromuscular, and biochemical effect provides an environment that enhances the body's ability to heal, which ultimately reduces pain and increases range of motion. So down here's a picture of sort of a needle going in and being pulled out, and you can see the little lesion that's left on the far right there. That's called our therapeutic lesion. That's what the body's going to centralize around and heal and increase blood flow to that area and help create a little more healthier environment there for you, and also have a chemical change within the body if working on certain trigger points to alleviate certain inflammatory proteins and the reflex arc inhibition for pain. So I'm not going to go too much into this. I just want you to take a quick look. This is one of many research articles. Like I said earlier, this is based on medical research to prove that it works. These are very numerous. This is just one clinical trial. There's a lot more out there with a lot more different symptoms and areas that have been worked on. But like I said, I'm not going to get into this, but it's just wanted you to know there's tons of research out there. If you're a skeptic, I encourage you, please dig. You will find a lot of information. So how will I feel after I get treated? This will vary, but many patients experience immediate relief of their symptoms and increase in range of motion. Soreness can be common from the needling, but does not occur with all people. Some individuals may experience an immediate achiness or a delayed soreness into the next day. The soreness, if present, will usually last maybe a day or so. Use heat and light massage as well as movement. It can be very beneficial to kind of get out of this little stage if this occurs. Mild bruising, and I mean mild, like the end of a pencil head possibly, may occur at the needling site and is more prevalent in certain areas of the body. Application of ice, also using arnica, will help the bruise recover quicker. So what is the procedure and what does it do? Again, a sterile monofilament needle is inserted through the skin and into the symptomatic tissue. The mechanism of action for dry needling is it creates a microlesion within the symptomatic tissue, releasing the tension in the shortened tissues and promotes an increase in the circulation, all while causing a non-pharmacologic natural biochemical cascade within the body, thus promoting healing. This mechanical and neuromuscular, also I want to add neurological effect and physiological effect, provides an environment that enhances the body's ability to heal and decrease inflammation, which ultimately reduces pain. So how many treatments will I need? This will depend on the category that you fit in, okay, which is determined by the state of the injury. Is it chronic or is it an acute injury? How long have you had it? That kind of thing. Remember, we are attempting to cause mechanical and biochemical changes without any pharmacological means. Again, it's a dry needle, no medication, okay? Therefore, we are looking for a cumulative response to break the pain cycle. All right, your doctor and myself will give you a little more insight after kind of talking and discussing and seeing what we're dealing with. So this is just to show you a few of the nerves here that we are going to affect. Also some of the dermatomes. Again, I'll let you go back and pause later if you'd like to really look at this. This is correlative to the vertebra, C2, C3, T3, so on and so forth, in the areas that affect it. You can find other images as well, which is the posterior back side of the body and the side if you really want to kind of learn this stuff. It's good information. Shows you which areas of the body are sensory related dermatomes with the vertebra. Okay. Just here, just wanting to show you a few of the areas that are very common that I work with. Top left is basically muscular trigger points here. I can also tie in other types of trigger points as well. Medial tibial stress syndrome. This is basically a painful lower leg symptomatic sort of disorder here. And then tension headaches. So just so you understand the process of it, usually misaligned vertebra. Obviously, I'd like to correct that first. That affects the signals, become irritated, which send warning signals to the neck muscles. And the neck muscles tighten up spasm to protect misaligned vertebra, which irritates underlying nerves in the neck. These irritated nerves send warning signals up to your head muscles. They respond also by tightening up. And then these tightening of the muscles create a chain reaction spasm encircling your whole head, known as a tension headache. Okay, so the needle adjustments help this, massage help this, needles help this. These are all very good forms of treatment. Okay, posterior tibial nerve. We can work on this for plantar fascia. Also, this is just giving you a view of sort of a little bit of the neurology that occurs in the bottom of the foot. The feet are a little more sensitive. Those of you that have had it done know that. But again, this is a quick, kind of procedure. So, this can help plantar fasciitis as well as other issues regarding the feet. It's just a little anatomy here, so you see the big sciatic nerve on the left, the branches of it, just so you can know how complex this nerve actually is. Also, anatomy of the foot over on the right. Again, you guys can pause and come back to it if you'd like. So, what kind of education you receive? This here. I can't tell if the audio is working or not, but if not, I'll try to get this on the site soon too. Okay, so thank you guys for being patient. I just wasn't able to hear sound on my end. I hope that you guys did. If not, you can obviously YouTube this video and look it up, get some sound on it. This just shows you the coursework and certification that we needed to go through to become certified integrative dry needlers. Also, you have to have a doctorate degree in an area of health care that is accepted. And it's just a little funny little comic, I thought. So again, as I said earlier, you don't have to be working on the area of pain to have an effect on it. So again, these nerves are traced back to the brain neurology, the pain cycle, and also again homeostatic trigger points. We can have an effect on several different ways in several different areas. We don't have to be just localizing our treatment. Okay, so I hope you guys learned a lot tonight, and have a wonderful night, and won't be talking to you again until 2019. So have a wonderful Christmas and a Happy New Year. Thank you for tuning in.